Good evening, everyone. This is Dr. Charles with Perfect Origins, and we have a fantastic show lined up for you tonight. And as you know, I am all about finding natural solutions for your problem. And during this mind-blowing presentation that we're going to be sharing with you, I have a very special doctor that I'm about to introduce. His name is Dr. Ryan Bentley. And Dr. Bentley takes pleasure in speaking nationally, helping patients researching, studying, and writing. He's been a provider of functional medicine and chiropractic for the last 13 years, and he is currently completing his doctorate of medicine degree and a PhD in biomedical sciences. He's been described as one of the brightest young leaders in the field of nutritional medicine. He's definitely a true innovator, and he's emerged on the natural scene in all national medicine circles with his engaging seminars and the release of his two books, Sex, Lies, and Cholesterol, and Vessels That Thrive. And both patients and practitioners just absolutely love these books. Dr. Bentley is also, in his spare time, co-founder of two companies created to educate practitioners on how to construct proven, objective, and quantifiable systems and protocols to help their patients reach optimal health. He's taught his principled nutritional approach to thousands of doctors around the country. So we're going to be talking to the teacher of teachers. Dr. Bentley, how's it going tonight?
It's going great, Dr. Charlie. I appreciate you having me on. I appreciate the opportunity to share the knowledge that I've been blessed to gain, that I can hopefully improve and people can gain health by listening to this webinar and use this information. And it's been said that, you know, when you gain knowledge, that's great, but when you apply it, it becomes wisdom. So for the listeners out there, I just appreciate you being on tonight, taking the chance to learn how to better your own health and those that you love. And with that, we can make the world a better place. So, Dr. Charlie, I really appreciate you again having me on here. I do want to just give a note that while the world at one time used to be considered flat, and we know it is wrong now, that it is actually round, with this information that I am presenting here, I have done everything possible to make it the most up-to-date, relevant information with regards to thyroid and Hashimoto's disease. With that said, science changes. We learn new things. But I can tell you what I have listed here is the most up-to-date information that we could possibly get with regards to the thyroid. However, some of the information may change over time, and that's just because new research comes out every day. So again, just please understand that this is not meant to treat or cure any disease. This is for educational purposes only, and I'm trying to present the most relevant information possible. And with that said, I like to get the most cutting edge because it takes about 20 years for things to become routine in traditional medicine. You know, they knew in late 1970s, that spina bifida can be caused by folic acid deficiencies. And it wasn't until 1992 that the Journal of Obstetrics and Gynecology mandated that every pregnant woman take folic acid supplementation. Well, there's a lot of people born in that time frame, so I like to take the most relevant, brand new information out there and utilize it now instead of later. First, do no harm. So again, with that said, I hope you enjoy this presentation. And Dr. Charlie, if you're okay, I'd like to give the listeners an overview of what we're going to be talking about. Is that okay?
Yeah, it sounds fantastic, Doc. Let's do it.
So first, I want to give you guys an understanding of thyroid metabolism and what the thyroid does and what it means and how it all functions together. Why is TSH? Most people understand that doctors will say your thyroid is great, your TSH number is normal. But that doesn't really give you the whole picture and tell you about what the thyroid is truly doing. So again, with that said, we're going to talk about TSH. We're going to talk about thyroid and leaky gut syndrome. We're going to talk about thyroid and autoimmunity because in the industrialized world, specifically in the United States, thyroid disease, the #1 cause is autoimmunity. Worldwide, it's iodine deficiency, but not in the industrialized United States. As well as the impact of gluten. You know, gluten is all over the news. Why? Because there's lots of information coming out about it now. Gluten is not a fad thing. It is a true, relevant thing that can damage people's thyroid. We're going to talk about estrogens and how estrogens affect the thyroid. We're going to talk about how stress impacts your thyroid. We're going to talk about the top blood markers that you must have run in order to get a true understanding of how the thyroid is functioning. We're also going to talk about what nutrients the thyroid needs, how to assess the root cause of thyroid dysfunction, and how and where to get tested. Now, it's very important today that we take all this information and realize that I only have a short period of time, that I'm not going to be able to give you everything that I want to tell you. Otherwise, we'd never get off the line. But nonetheless, I'm going to give an overview of a lot of different topics with regards to the thyroid. So again, that's what we're going to cover, and I thank you for the time of being on here, Dr. Charlie.
Yeah, we're excited to have you, Doc. I get a lot of questions from people who purchase Live Lane asking about thyroid health, and I just think that this is such a big topic that needs a lot more care than just Live Lane itself. And there's a lot of happy people out here on this seminar. So thanks.
No, not a problem. And when it comes to Live Lane, we're going to learn tonight how the liver impacts your thyroid function. So that's going to be a great topic as
Absolutely.
well.
Great.
So let's dive in if you're okay with that, Dr. Charlie. I'm ready to just jump right in and start sharing with people what the thyroid is and what the thyroid does.
Yeah, absolutely. Let's do it.
Okay. So first we need to identify where the thyroid is. So I want all the listeners right now to find that notch at the base of their throat. You'll feel that notch right where your sternum or your breastbone, right at the top there in your throat. And then you'll press in a little bit in that notch, and then take your two fingers and you'll feel a little soft piece. And that soft piece is right here. That's called the isthmus. And then you have the rest of the thyroid gland on each side. You know, we've got the left side and the right side. So when you swallow and you have your fingers placed over the trachea right there in the front, you can feel it rise up, and that little piece of tissue underneath, that's the thyroid. And you can go out and palpate it right along the sides out here. And if it's enlarged, that's not a good thing. But you should feel some soft tissue, but nothing large or any big lumps. You should get that checked out if you do. But what does the thyroid do? So that's where the thyroid is located. And it's not a huge gland, but what exactly does it? Well, the thyroid controls the basics of cell metabolism. So what does that mean? It gives you the energy for your body. It turns glucose, which is sugar, and fatty acids, which is fat, into ATP. ATP is your body's energy source. It's what your body uses to make energy. So again, that is the basis of what the thyroid does, is it helps your body make energy. So it increases what's called your BMR, your basal metabolic rate. That's the rate of metabolism. That's what your body burns as far as calories at rest, doing nothing but lying there. That's your basal metabolic rate. It also stimulates protein synthesis. We have to have proteins in our body to make enzymes. Enzymes is what makes our body work. Without enzymes, we can't convert the glucose and the fatty acids into ATP for energy for our cells to use so our cells can repair. And now what's even more interesting is that every cell in your body has receptor sites for the thyroid hormone. We have 100 trillion cells in our body, and every cell in our body has receptors for thyroid hormone.
So, Doc, you're saying that since every cell has thyroid receptors, this would actually affect every single cell in the body, right? Is that what you said?
Oh, absolutely.
Okay.
Absolutely. That's exactly what I'm saying. It's going to affect, when your thyroid is not functioning, it will affect every cell in your body. We're talking the brain, the gut, so your gastrointestinal system, your cardiovascular system, your bone metabolism, your liver and gallbladder, steroid hormones such as estrogen, testosterone, cortisol, glucose and protein metabolism. It's going to affect your temperature regulation. It affects everything in your body without question.
That is incredible. It's such a tiny little organ, has such a huge impact.
Yeah, it absolutely blows me away the things that the thyroid actually does in the human body, and how many people use one simple test and think that that is going to tell you everything about the thyroid, when the prevalence of thyroid disease is pretty high in America. It's actually 1 out of 7 adults have thyroid. So if you look at Gilligan's Island, you know, we've got 7 people here. Which one do you think has hypothyroidism? Because if it is hypo and not working, you're not going to burn sugar. You're not going to burn fat. So you can kind of look, this guy's looking a little bit more like he's got some hypothyroidism going on. He's got thinning of the hair. He's got some myxedema. They got the round face, essential pedal obesity. All those things are signs of thyroid. Looks like he's got his ring on his pinky because he's probably retaining a lot of water, which will be a sign of thyroid dysfunction as well. And it affects 30 million women. 30 million women.
Wow. Doc, can you go ahead and review the symptoms that like some of our customers would experience if they have low functioning thyroid?
Yeah, so again, as I said, the thyroid makes ATP, which is our body's energy source. So without the making of ATP, guess what we're going to have? We're going to have fatigue. We're going to have weight gain. And why weight gain? Because again, I said the thyroid stimulates the burning of glucose, which is sugar, and the burning of fats. So imagine if, Dr. Charlie, if you had someone delivering wood to your home every day to burn in your wood-burning stove, but you never light your wood-burning stove. That wood is just going to pile up, wouldn't it?
It would.
And so in the same way, if you're delivering by eating glucose and fat into your body every day, you're adding these calories, but your body's not burning it, it's going to pile up, which is why you get the weight gain. In the same way that when someone's delivering wood to your home every day, but you're not burning it, it's just going to pile up and pile up and pile up. Also, we have with low thyroid function, you can have cardiovascular health issues, such as dyslipidemia, which means that you have cholesterol issues. Now, and also atherogenesis. I talk about extensively in my book, Sex, Lies, and Cholesterol, about cholesterol levels and what that truly means. We don't have enough time. That's a whole webinar in of itself, and we may do that one evening if you like. If your listeners like this webinar today, then maybe we can do some more down the line. Talking about also glucose intolerance and insulin resistance. So again, if you don't have normal thyroid function, you're not going to burn that sugar, so that sugar is going to stay in your bloodstream, which is going to increase your insulin resistance, which ultimately leads to type 2 diabetes. And also you get poor pregnancy outcomes. You've got to have, when you're pregnant, you need to have a normal functioning thyroid in order for that child to develop properly.
Yeah.
And so as I said, it truly affects every cell in the body. I mean, it literally will impact everything. So in the brain, some of the things you're going to get is foggy thinking, low motivation, depression, anxiety, fatigue, hard time dealing with stress. Your heart, you're going to have a slow heart rate, or you can have a fast heart rate and palpitations. You can get carpal tunnel syndrome because you retain water. In fact, I was working in an emergency department last week, and first time in 13 years I've ever seen the Snell's test positive for somebody that's carpal tunnel is that bad because she was retaining so much water.
Wow.
Sex organs, you can have menstrual issues, polycystic ovarian syndrome, low libido, infertility, frequent miscarriages. You get in the legs, you can get edema and swelling in the legs, varicose veins. Digestion could be constipation, bloating, gas, low stomach acid production, gallstones, liver dysfunction. Your hair, skin, and nails, your skin will feel dry, and same with your hair. To seem lifeless in your hair. You can get hair loss, brittle nails. Your skin can start to dry and crack at the heels. And also your throat. You can get difficulty swallowing because the location of where the thyroid is, it's right there over the trachea, and behind the trachea you have the esophagus. So if it enlarges, it's going to put pressure on that, and it's going to make it difficult to swallow. You get hoarseness in your voice because it's going to mess with the voice box as well. So there's just some of the basics of what people can feel when their thyroid is not functioning properly.
Well, you and I both know people that can have these symptoms for a number of reasons, Doc. So go ahead and explain to us, like, how do you properly evaluate the thyroid gland and determine if this issue is related to the thyroid?
Oh, absolutely, yeah. And with that said, you mentioned that many people can have these symptoms for a number of different reasons, and you're absolutely right. You can have a candida infection. You can have obviously a thyroid dysfunction. You can have anemia. There's so many different things that can go on that can create these symptoms. People will have mercury, whatever. And that's what a lot of doctors do, is they'll blast something out there thinking that this is the cause of everybody's problems. And so next thing you have is this great miracle supplement that really doesn't even fit with physiology, and it doesn't fix their underlying cause. That's why I love, everybody needs some liver function, because we live in a toxic world. So your liver product is a great product to help with that. But with regards to thyroid, in order for us to, how do we properly assess to determine, is this a thyroid problem that's causing this, or is it something else? You need to have a proper evaluation, but let's talk about the thyroid and how that works. And so in our brain, up top, we have what's called the hypothalamus. The hypothalamus will release what's called TRH, thyrotropin releasing hormone, that will talk to the pituitary. The pituitary is also it sits just south of the brain, still in your head, inside your skull, is the pituitary gland. That will release what's called TSH, which is thyroid stimulating hormone. That will stimulate the thyroid to produce thyroid hormone. 95% of thyroid hormone is called T4. Now T4 is pretty much inactive. It doesn't do much at the receptor sites. It doesn't bind nearly as much. It doesn't stimulate as much. What does is T3. And 5% of what the thyroid makes is called T3. So that's 5%, and that's the active form. So we have this 95% that's inactive. Well, it has to get converted in the liver, in the kidneys, and in the gut, which is why the liver is so important, because if the liver is not functioning right, you can't convert this inactive form of T4 into the active form. Your kidneys are part of the detoxification process as well. If the kidneys aren't working right, you can't convert T4 to T3, which again is the active form. And then the gut, you've got a new perfect probiotic product out that is great, because 20% of the inactive form gets converted to the active form in the gut. And that is dependent upon having healthy flora, a healthy gut. So I mentioned earlier, someone could have candida, which is a yeast infection in the gastrointestinal system or the vaginal tract. But if it's in the gastrointestinal system, well, that means you don't have a proper balance of good bacteria, which ultimately would lead to thyroid dysfunction, which may be why some people are having those symptoms that they are having. So nonetheless, you can see how the liver and the kidneys and the gut are so important, which is why I love what your company is doing by having products that support detoxification and support gut health.
Yeah, we believe it's crucial, Doc. It's just from what we've seen, it's so important nowadays, especially.
Yeah, when we live in such an industrialized world that's chock full of toxins, it's definitely going to make a huge difference. And if we look at this active form of T3, it ultimately affects the cell nucleus of every cell in your body. So let's look at this. What's this dynamic? What's this relationship? How does this work? So when the blood levels are low of T3, or there's a low metabolic rate, which means your body is not making enough energy, your hypothalamus will register that. The hypothalamus, again, will release that TRH, which will go to the anterior pituitary, which will release TSH. Okay? So this release of TSH will therefore talk to the cells in the thyroid to say, hey, start making some more thyroid hormone. So what happens is this guy tells this guy to yell at the workers and start making some thyroid hormone. If there's plenty of product, plenty of thyroid hormone circulating around, it will go back and tell the foreman, so to speak, and say, hey, boss, we've got enough product. We don't need those workers to keep working. So then the boss will quit yelling at the foreman, and the foreman will quit yelling at the workers, and so that means that the TSH will come down. When the thyroid is low and not functioning, the boss yells, so the TRH goes up, and then the TSH goes up, and then the thyroid starts to make more. So that's why doctors will say the TSH really gives us a great picture if the thyroid is overfunctioning or underfunctioning. If it's overfunctioning, it's producing too much of this, and it will create what's called a negative feedback, which your TSH level will now become low. However, if there's not enough thyroid hormone circulating around, your TSH level is going to go up, because now the pituitary is yelling at the thyroid again to make more product. So when you make more product, what does this do? It increases your basal metabolic rate. It stimulates the synthesis of sodium, potassium, ATPase. It increases your body temperature. It stimulates protein synthesis. It increases the use of glucose and fatty acids for ATP production. Stimulates lipolysis, which is fat breakdown. It enhances some of the actions of catecholamines, which are your fight or flight response. They're your stress hormones. And it regulates the development and growth of the nervous tissue and bones, which again is why the mother must not have a thyroid issue when the baby is developing in utero. So those are just some, that's how the thyroid itself communicates and works, and why we'll use TSH, but we'll also should be looking at T4 and T3.
So you're saying right now, medical doctors, typically their gold standard thyroid test is TSH. So you believe that, do you believe that TSH is the best test to evaluate the health of the thyroid?
A quick answer to that is no, but let me explain. So yes, TSH is the most common marker used to assess thyroid function, and it's also the most sensitive for the reasons that I just described. But the problem is that it assumes that the hypothalamus and pituitary function is normal and intact. So if the hypothalamus is not working, well, then it can't communicate to the pituitary. Or if the pituitary is not working right, the hypothalamus could keep screaming at the pituitary, but the pituitary can't do anything because it's not working. Does that make sense?
Yeah. Yeah, that's definitely anybody who's listening, pay very close attention to that because a lot of people out there are getting misdiagnosed for not having thyroid when it actually could be a thyroid issue. And right here is where Dr. Bentley is like actually showing you otherwise. So basically telling you that you're not crazy.
Yeah, you're not crazy. And here's the deal. So when the thyroid is an issue and the thyroid's not working and producing thyroid hormone, that's called primary hypothyroidism. If it's because the TSH can't yell at the thyroid to make it because this isn't functioning for whatever reason, that's called secondary hypothyroidism. And then tertiary, the third degree, is the hypothalamus not functioning. So you got tertiary, secondary, and primary hypothyroidism. So looking just at the TSH, again, it is the most common marker and it's the most sensitive, but again, it assumes that the hypothalamus and pituitary are normal and intact. It also assumes that the patient is stable and has not had treatment for the thyroid. It does not measure the sensitivity of the TSH receptors, so its ability to listen to TRH. It doesn't assess the sodium iodine symporter and thyroid peroxidase enzyme, which helps make thyroid hormone by using iodine. And it doesn't factor in the key nutrients that the thyroid needs, such as tyrosine and iodine. And we'll talk more about that later. Oftentimes, this is the only marker that your doctor will order. And again, that's because the hormone is released by the pituitary when it gets the signal from the hypothalamus. TSH levels increase when T4 levels drop, just as I talked about. And TSH levels will decrease when the TSA or the T4 or T3 levels increase. So that's something that we need to pay attention to. But what I want to show you is, let's look at this patient. So I had this mom come into me, and this is a classic example. The mom came in. She came to me because her hair's falling out. Now, she was overweight, probably, I can't remember, somewhere around 200 pounds. So she was overweight. She had the moon face. She had bags under her eyes, a lot of tissue swelling, dry skin, heels were cracking, hair is falling out. The lateral third of the eyebrow is falling out as well.
Oh,
And she was very fatigued, but however, she's like, you know what, I feel great. I'm coming in because my hair's falling out, and everybody tells me everything's normal. I looked at her and I said, you look like a hypothyroid patient. I can tell you that right now without doing any blood tests. She takes her blood test, throws them down on the table, and says, all the doctors have tested my thyroid. They tell me I'm fine. And I said, well, that just looks at your TSH. I said, we're going to look more comprehensively at your thyroid gland. And I explained to her what I'm going to be teaching you this evening. And this is the panel that I ran. If you notice, her TSH level, 0.45 to 4.5 is normal, and she's at 2.2. So would we consider that normal, Dr. Charlie?
yeah.
Yeah, so yeah, that's pretty much normal. We look at her T4, that's pretty normal, right in the middle. We look at her T3 uptake, 28, and 24 to 39 is normal. That's pretty normal, not bad. And her free T4 is 1.11, which is smack dab in the middle. So everything with the thyroid looks great. But what I did is I ran thyroid peroxidase enzyme, or antibodies, to see if she had an autoimmune disease. And look at that, 141.
Wow.
So all these doctors did not, you don't know what you don't measure, Dr. Charlie. And that's the craziness, is you can't assume things, because again, if it looks like a duck, it walks like a duck, it quacks like a duck, it's probably a duck. And so this patient looked like a hypothyroid. They tested everything with it, what they consider important with the thyroid. Sorry. And sure enough, they didn't look comprehensively, so I tested the antibodies, and bam, there it is, staring at us right in the face. And what's even more interesting is that she goes, you know what, well, my daughter's 12 years old, and she's having the same issues. Her hair's falling out.
Oh my gosh.
And I said, okay. Yeah, 12 years old, and the doctors told her that the issue is that she's just reaching puberty. And I said, well, the apple doesn't fall far from the tree. Why don't we evaluate your daughter? Now, the daughter, she was 12 years old. She was overweight for her age, definitely overweight. So again, she's not burning the glucose and the extra fat in her body. She's not burning it off. So there could be a problem with the thyroid. Hair's falling out. So I got some symptoms that correlate. Well, guess what? I tested her thyroid, and sure enough, TSH came back normal, the T4 came back normal, the T3 uptake came back normal, and the free T4 came back normal. But guess what? I tested the thyroid peroxidase antibodies and the anti-thyroid globulin, which are two different antibodies that you can test for the thyroid. And look at that, 137. So just like the mother, the daughter's thyroid was under autoimmune attack, which means the
Wow.
body is basically attacking the thyroid.
Okay, Doc. So what does it mean to have antibodies to the thyroid gland? Can you explain that a little more in depth for our listeners?
Yeah, absolutely. So with that said, to get an understanding of antibodies, we have a little bit of an understanding of the immune system. In particularly, why gastrointestinal health is so important. So just think about this. There's only two ways things enter the body. It's either through our skin or our mucous membranes from our nose down to the rectum, which includes your gastrointestinal system and your respiratory tract. Okay? So what's interesting is 70% of the immune system is around the gut. Why is that? Well, if you have an opening in Border Patrol, where are you going to put all your troops, Dr. Charlie?
Yeah.
Right where the hole,
Yeah.
where the hole is, right?
Exactly
Portal
right.
of entry. So in the same way, this is our digestive system. And we put food, this is still outside the body. Think of a donut hole, and this is the hole inside the donut. So if you take a donut with a hole in the middle of it, you stick your finger in the middle of that hole, you're still outside the donut. Now you move your finger to the side and you stick your finger in the dough, now you're in it. So I want you to think about the gastrointestinal tract is still outside the body. So that's why we have the immune system that lines right up around the gastrointestinal system. So what happens though is with leaky gut is basically all the junk that we put into our body, all the preservatives, all the foods such as Twinkies and Ho-Hos that half of them are chemicals that you can't pronounce. They're not natural, Dr. Charlie, are they?
No, they're not.
And they wreak havoc on our system, specifically the liver, which is why you had that product to help the body rid the junk. And what's interesting is everything that enters the gut goes directly to the liver, which is why the GI system is so healthy. But what happens is your gut lining should be like a screen in your window. It should only let small particles in and out. So it should only let like air particles coming in and out. Now imagine in your window, Dr. Charlie, if you had a chain link fence for your windows in your home. Would bugs get in your house?
Oh, you'd have tons of bugs.
Yeah, you would get squirrels, you could get some rabbits, you can get some birds, all these things flying in your house. So, and then what you want to do is you're going to try to kick them out because you don't want them inside your house. Same thing with the body. So when you eat something, it comes into your body. It's called, and if you have leaky gut because you have intestinal permeability, whatever it is, it could be a bacteria, a virus, a fungus, a protein, such as a protein from food, such as gluten. It can enter your body. Your body recognizes it as something foreign. So your immune cells come up and say, hey, this guy's not part of us. So Mr. T cell comes, and he's kind of the deputy, and then he goes to all the people underneath him and say, hey, guys, take a picture of this guy and go post a bunch of America's Most Wanted posters. Those are antibodies. Antibodies are basically taking a snapshot of whatever this foreign protein is, taking a snapshot, and the officers say, go kill anything that looks like this. Go reprimand this guy. However, the problem is sometimes the fingerprint, if you will, or the barcode, like the barcode on your grocery store products, you know what I'm talking about, Dr. Charlie, when you scan things at the grocery store, it goes boop. So same thing. Your immune cell will say, boop, kill anything that looks like this. If it looks like the antigen, it's going to come and attack it. If it looks like your thyroid, it's going to go attack your thyroid. Because the antibodies confuse the self with glandular tissue. And that's what antibodies do. It's trying to attack this, and when it binds to this antigen, it calls all the immune cells. It's like, hey guys, over here, I found them, I found them. But what's happening is it will bind to your thyroid sometimes too, depending upon your genetics. If it binds to your joints, you get rheumatoid arthritis. If it binds to your skin, you get psoriasis. If it binds to your myelin sheath in your nervous system, you get multiple sclerosis, so on and so forth. That's a generalization, but that is autoimmunity in a nutshell.
Wow.
And so that causes all kinds of inflammation to your system. And that causes pain, swelling, tissue damage, such as joint destruction, or it can cause tissue of the gland destruction and make the gland not function the way that it's supposed to. So that, again, is kind of antibodies and autoimmunity. Was that clear? Did that make sense?
Yeah, so basically what you're saying is someone with an autoimmune condition such as, the thyroid condition, it can be caused by your diet, by eating gluten, right?
Absolutely. It can be caused by a number of issues, not just gluten, but it can be caused by viruses, bacteria. There's also things, you can have a selenium deficiency that can create autoimmune thyroid because it causes the cells to rupture. But more on that later.
Yeah, and that's
Uh,
exactly why we actually have really patented, very good form of selenium in liveling, was just because of that, honestly.
yeah, and
I
so
don't know
that's
if you knew that or not, but we have a very good form of selenium in liveling.
no, I didn't know that you had a patented process on the selenium in there. So that's great because that's a key nutrient that people need for the thyroid to function normal. But as we were talking, with regards to overall health and thyroid condition, and I mentioned gluten, so let's talk about that for a second, just so our listeners, since gluten is all over the news, people are learning about it. Can gluten cause autoimmune thyroid? Absolutely. Look at some of this research, Dr. Charlie. In 2008, Journal of Autoimmunity said gluten sensitivity is specifically increased in patients with autoimmune thyroid disorders. All patients with autoimmune thyroid disorders should be screened for gluten sensitivity. If you look here, World Journal of Gastroenterology 2007 and Physiology Research in 2003 both state screening patients with Hashimoto's thyroiditis for celiac disease and vice versa should be common practice. So my question is, I wonder how many people with autoimmune thyroid disease have not been tested for gluten sensitivity to try to see if they could reverse this process. And did I say reverse? I can't say we cure disease or that you can cure disease because that wouldn't be considered a disease in America. But let's look at not what I say and what my opinion is. Let's look at the American Journal of Gastroenterology in 2001. The greater frequency of thyroid disease among celiac disease patients justifies a thyroid functional assessment, which means more than just TSH. In distinct cases, gluten withdrawal may single-handedly reverse the abnormality. Did you hear that, Dr. Charlie?
I did. It amazes me that this is from 2001, and we are now in 2014. And
Yeah, and this is still considered new research.
it's,
Um,
wow.
it blows me away. So give another 10 years, it'll be common practice. But if we look here also, the European Journal of Gastroenterology and Hepatology, the liver, in 1998 says celiac disease patients have a 10 times increase of autoimmune thyroid disease. Why is that? Because they have autoimmune disease to gluten that damages their gut, makes their gut permeable, and things cross into their bloodstream. The body scans it and says, boop, kill anything that looks like this. If it looks like your thyroid, it's going to attack the thyroid. And then also, if you look here, the Journal of Clinical Gastroenterology in 2002, a gluten-free diet may have profound impacts on patients with autoimmune thyroid disease. And then the last one that I have here to share with you is very interesting. It says, the prevalence of celiac disease in patients with thyroid autoimmunity. What I've highlighted here, it says, on a gluten-free diet, an excellent clinical and histological response was recorded with an improvement of hypothyroid and reduction of thyroxine dosage. Meaning that histological changes means that the tissue is changing, the tissue is becoming healthy again. And they recorded improvement in hypothyroidism, which meant that it started functioning better so they could reduce the amount of thyroid medication they were taking. Isn't that amazing?
That is amazing.
So one
So
simple
simple.
protein getting into their body can wreak so much havoc, but yet removing it can reverse that abnormalities according to the research.
So what was the cause of the mother and daughter's autoimmune thyroid condition? Was it gluten?
You're absolutely right. It was gluten. Because again, approximately, I look at, there's different research, but you can guarantee relatively at least close to 30% of people with autoimmune thyroid disease would have an issue with gluten, some level of a non-celiac gluten sensitivity or a gluten sensitivity, such as celiac disease. And so what I did is I ran a test from Cyrex, which looks at a number of different proteins and looks at the intestinal antibodies and looks at things with regards to the patient. So here is the mother's results of testing her for gluten. From here all the way down to here are different gluten proteins in the body. And you can see she reacts significantly to 1, 2, 3, 4, 5, 6, 7 different gluten proteins. and then she reacts here and here as well. And then if you look at the transglutaminase complex, that means it's binding to her intestinal wall, causing damage, which also is shown up in transglutaminase 2, indicating that there's damage to the gut lining. Transglutaminase 3, it tells me that it's causing issues with hair follicles and the skin. And transglutaminase 6 lets me know it's damaging her nervous system, or potentially damaging the nervous system. There's a high prevalence of, if you have transglutaminase 6 and you react to gluten antibody and have gluten antibodies, there's a 90-some% correlation that that is causing the issue within the nervous system. And so we caught all this very early on in this patient before things got really bad. But what's interesting, Dr. Charlie, is that the average age of diagnosis of gluten issues, such as celiac disease, is between the ages of 30 and 50. And that's because it's a process. It doesn't mean you eat it once and all of a sudden, bam, everything goes haywire. It's a process. It takes years for your gut lining to get destroyed to start causing other autoimmune disease and cause issues. And so again, as I said, like mother, like daughter, right? So
Right.
let's look at the daughter's test. You can see here she reacts significantly to the gluten proteins as well. And you can note here the transglutaminase complex that's the binding to the cell walls, and transglutaminase 2 is not elevated yet, but if you look at things that are negative, it's like 0.5, 0.6, 0.4. She's at 1.5, which tells me what? It's on the rise. It's elevating, and again, it's a progression. It's a process of what gluten does to the body, that it slowly destroys people that are sensitive. I've had people that tested absolutely negative to gluten, and they're fine with it. So it's not absolutely everybody and their brother needs to be off gluten. However, I can tell you I've never met a patient be unhealthy for not eating gluten and grain products.
Yeah, no.
Never met anybody be unhealthy because of that.
Yeah, no. I tell my patients and my clients that have celiac disease that it's a blessing and it's a curse. I understand why it's a curse, but you also got to see it as a blessing because you're going to feel so much better just because you're forced to avoid that, right?
Absolutely.
And you know what's crazy is to believe that a food that we have been told to eat every day, that's even in our food pyramid, such as wheat, that has gluten in it, can cause an autoimmune thyroid condition. How weird is that?
Yeah, it's crazy. What's even more crazy, Dr. Charlie, is all the things that it can cause in somebody. So we just talked about thyroid. Well, let's look at all the effects with regards to disorders that are associated with celiac disease. Some of these are, with regards to autoimmunity, is antiphospholipid syndrome, which can cause early clotting and cause recurrent miscarriages. As you can see, miscellaneous, you have miscarriages over here, and female and male infertility. You can have IgA nephropathy. You can have Sjögren's syndrome, which means it attacks your secreting glands. Hashimoto's thyroiditis that we talked about, Graves' disease, which is another autoimmune thyroid disease on the other end of the spectrum, making it hyperfunctioning. Addison's disease, which means that your adrenal glands have crashed. Hemolytic diseases, which means that it damages your red blood cells. Myasthenia gravis, which is a neurological disease. Autoimmune hepatitis, so again, dealing with the liver. Primary biliary cirrhosis, which is what Walter Payton, or primary sclerosing cholangitis is what Walter Payton died from, which both affects the liver and biliary tree, which is your gallbladder and the bile ducts. And then the primary biliary cirrhosis, so cirrhosis going on as well, which is basically scar tissue developing.
That's so
Alopecia.
interesting. Yeah, I mean, this is just one thing because I'm really big on the liver and liver health, as you know, and that is like one of the one things I try to tell people when they ask me if they haven't even bought Liveline. That's the first thing I say is that you need to cut out gluten. So, and that's in the diet manual that we give to our customers as well. But it's so big and it's just so crucial for the health, not only of the liver, but just your entire body.
Yeah, absolutely. And it's, it affects the skin and it affects your gastrointestinal system by, not helping it will kill the cells, and you make antibodies and it destroys the cells, causing atrophic gastritis, which means that you can't make enough hydrochloric acid. You can get things such as multiple sclerosis, brain atrophy, irritable bowel syndrome, and inflammatory bowel disease. Cerebellar ataxia, which is what they've called now in 2004, gluten ataxia, which means that
Huh. I didn't know that.
attacks, gluten can attack the cerebellum in the brain, which will cause a discoordination in your walking and your movements. It's related with Down syndrome and Turner syndrome, anxiety, depression, schizophrenia. That is huge. It's actually probably one of the things I want to do my research on with the PhD that I'm doing right now is with schizophrenia. So
Oh, wow.
very interesting that there's a large percentage of people that are schizophrenic that will go on a gluten-free diet. It's roughly 50% of them, and then they no longer have to be on the meds and quote-unquote institutionalized or in a program of some sort.
Wow, it's that high?
Yeah, that respond very well. Yeah, very in
That
one of
is
the papers that were published, they responded. 50% of them responded very well. Doesn't mean that everybody with schizophrenia has it because of gluten.
right.
However, if they have a gluten issue, it can definitely cause that problem.
Well, it's
And
only going to
it
help even if it's not the main cause. I mean, just as you showed some of the other health benefits for that person, I mean, it's just going to allow their body to focus all its healing energy onto
yeah,
another
it's
product.
not going to hurt them by any means
No.
by going off gluten. If anything, they just get a benefit.
So basically, certain infections have been associated with autoimmune thyroid disease, and vitamin D deficiency has been linked to this as well. Because, like you said, it creates leaky gut. What I find most interesting is that 20% of the inactive thyroid hormone becomes activated in the GI tract. And this activation is dependent upon, healthy intestinal flora. So it blows me away to think about how many people have taken antibiotics for an infection and never taken a probiotic to replace the good bacteria in the gut. And this just shows how important a probiotic is. It even affects your thyroid, folks. And Dr. Bentley, we'll talk about stress here in a second. But I know that you know a lot about Perfect Biotics because I know you've studied it very in-depthly. What do you think about that product? It's our new Perfect Biotics is our, like you said, is our newest probiotic, our newest supplement in our line of supplements.
When it comes to Perfect Biotics, it is by far the most superior probiotic out there that I know in the actual world at this point. It does things that no other probiotic does. I mean, it literally will enhance your detoxification processes in the body. It helps your own flora grow by 6 times. It helps your gut lining improve by 5 times, so taking care of that leaky gut. It's helped to modulate the immune system. And so with that, I mean, it's so important with regards to Hashimoto's thyroiditis and thyroid function to have a normal functioning intestinal system. And but there's so many different reasons that someone can go about. You mentioned, because of you, so I want to go back for the listeners and help them have an understanding that Hashimoto's thyroiditis in autoimmunity, since that is the #1 cause of thyroid dysfunction in the United States, can be caused by more things than just dealing with gluten. For example, you mentioned vitamin D. It's going to affect vitamin D. Getting too much iodine, heavy metals, estrogen dominance, which again, if you don't have proper balance in your intestinal flora, your body, your liver, so when you're using your liver product and helping the body detoxify estrogens out of the system, if you don't have a good balance, you have an overgrowth of a bad bacteria called Bacteroides. Bacteroides release what's called beta-glucuronidase, and beta-glucuronidase unconjugates the estrogens, which means that it gets reabsorbed again. So your liver could be dumping it, but if your gut's not healthy, it's going to reabsorb it, which is why your perfect biotic that you have, or the perfect probiotic, is so huge. Because again, you get to detoxify the liver and then dump it into the intestinal tract to be removed. And then if you use your Flora product, you can improve the gastrointestinal health by eliminating those toxins even more so out of the body and creating a good population of good bacteria that will not allow the bad bacteria to overgrow. Pregnancy, and also I want to mention menopause affects Hashimoto's. Gastrointestinal infections, which again is why having a healthy gut is important. Insulin resistance, and we talked about gluten intolerance. So when it comes to infections and the thyroid, there's things that have been associated with it, such as hepatitis C, H. pylori, rubella, rubeola, Epstein-Barr virus, rotavirus, influenza B viruses, Takasaki viruses. These are all viruses that have been associated with causing autoimmune thyroid disorders also. So it could be something like that. You mentioned vitamin D. You've got to have a proper, healthy, functioning liver in order to absorb vitamin D. Why? Because the liver creates the bile that goes into the gallbladder, and then you have to have a healthy gut, because if the gut lining is healthy, when you take in something that's fatty, and vitamin D is a fat-soluble vitamin, it will go from your stomach into the first part of your intestines called the duodenum, and then there it'll register and say, hey, we've got stomach acid, we also have some fat, so we need to release cholecystokinin. Cholecystokinin goes to gallbladder and causes the gallbladder to contract, which allows you to absorb your fat-soluble vitamins. So without the bile, you can't do that. Without the liver, you can't make the bile. And without a healthy intestinal lining, you can't release cholecystokinin to allow the gallbladder to work. So then you're going to become low in vitamin D. And what's interesting is the American Journal of Clinical Nutrition 2004 said low vitamin D is common among patients with Hashimoto's thyroiditis. Immunological Letters in 2000 says vitamin D helps against autoimmune-mediated thyroid dysfunction. Here are some of the symptoms of thyroid deficiency: rheumatic pain, muscle weakness, gradual loss of healing and fractures, hypertension, autoimmune diseases I've highlighted here, cancer, depression, chronic fatigue. Children get knock-kneed, bowed legs, spinal curvature, pigeon chest, tooth decay, excuse me, osteoporosis, osteomalacia. You know, if you look at some more studies, it says vitamin D deficiency may compromise the mucosal barrier, leading to increased susceptibility to mucosal damage, increasing the risk of irritable bowel disease. Holy smokes, are you kidding me? What did that just say? Well, before I break that down, let me tell you this. The active form of vitamin D, which is called 1,25-hydroxyvitamin D3, markedly enhanced the tight junctions by increasing the junctional protein expression, preserve the structural integrity of the tight junctions. So what that means, ladies and gentlemen, is that you have to have vitamin D in order for your gut lining to be healthy. In order for your gut lining to be healthy, you have to have a healthy liver. In order to have a healthy, to make bile. In order for that to happen, you have to have a healthy gallbladder. And so all these things work together. It's not if or, it's both. You've got to have both function. You've got to have a healthy gut and a healthy liver in order for this to work. So what about when it comes to liver? Liver makes 25-hydroxyvitamin D, which is the inactive form of vitamin D. It has to get activated at the level of the kidneys. So the active form here affects the tight junctions. So what does that mean? Tight junctions are these little proteins. This is what holds the gut lining together. When you have leaky gut, you damage these proteins and it allows things to enter into your bloodstream. So all these things cross in a body scan that says, boop, kill anything that looks like this, and it starts the autoimmune process. Which is why, if you look in the literature, vitamin D, in my opinion, this is why vitamin D is linked to almost every autoimmune disease known to the human species. Because without vitamin D, you lose these tight junctions, and now it allows things to enter into your bloodstream. Just like I said, you have a chain link fence in your window. It allows bugs and birds and squirrels and everything to enter into your home, and that's what's happening. You get this leaky gut, increased intestinal permeability, which increases the risk of autoimmune disease. So this is what it looks like microscopically. These are the kissing points, the tight junctions that are affected when your body is low in vitamin D. Here they are blown up. So this little section blown up here creates these kissing points. Without vitamin D, you don't have the shoestring, so to speak, to hold these cells together. And so, again, that's why you have to have the healthy intestinal flora, and 20% of inactive thyroid hormone becomes activated in the gastrointestinal tract. This activation is dependent upon healthy intestinal flora, which is where your perfect biotic product comes in. So
Yeah,
that is kind of
the slideshow for me. Yeah, looks good.
Yeah. So that in a nutshell, Dr. Charlie, is what creates this system. So when it comes to Hashimoto's and gluten and autoimmunity and gut health, the first thing that you have to do is replace the things that are missing. You have to replace, if the digestive enzymes are not working properly, you have to replace those. You have to remove the pathogens and the offending foods. So if you've got food sensitivities or you don't know if you do, you have to identify that. You don't know what you don't measure. And you have to re-inoculate. You have to repopulate the gut with good bacteria, which is what the perfect biotic does. And then you have to regenerate and repair, which is also something that the perfect biotic product does. It repairs this whole process. And you have to have, in order to remove, Dr. Charlie, what organ in the body helps remove junk out of the system?
Would that be the liver?
That would be the liver. Absolutely. So The two go hand in hand, and because everything, as I mentioned earlier, goes directly from the gut, directly to the liver through what's called the hepatic portal vein. So that, in a nutshell, is the perfect biotic in dealing with the gut and dealing with autoimmune thyroid and gluten sensitivity. So that was a lot of information, also covering vitamin D. Um,
Yeah, question
so
for you, Doc. Let's talk about, because I know a lot of our clients are thinking that they get their vitamin D from milk. Would you comment on that?
yeah, you have to have proper absorption again. And milk alkalizes the system, which changes the acidity of the chyme, which is the breakdown of the food as it goes from the stomach to the duodenum. And if you don't have that, you're not going to trigger the cholecystokinin release as effectively as what you would typically. So that is going to decrease that absorption rate there with the vitamin D. Again, your body also, again, in the liver, makes your own active form of vitamin D from cholesterol. So cholesterol is very much a needed process in our body. Cholesterol is also the precursor to your sex hormones and your stress hormones,
Yeah, I
which
know.
actually is a great thing, because I do want to talk about, if you're all right, is talking about stress in the body. Because again, if you've got too much stress, guess what? You're not going to have proper digestion either. And we can talk about that if you're all right, if we
Yeah,
move
yeah.
toward.
Let's go ahead.
So let's identify with regards to stress. So when I say stress, we have to have the understanding that there's physical stress, such as pain. If I hit your thumb with a hammer, that's going to create some stress, right?
Yeah.
You know, your heart rate's going to go up, your blood pressure is going to go up. You're going to be more angry, you're going to be more agitated when you get that physical stress. Anybody that's been debilitated with low back pain, that can create stress. Then we also have chemical stress. So if anybody's ever eaten food that immediately did not agree with them, they start sweating, their blood pressure started going up, their heart started beating faster. So that's stress. And then we've got emotional stress. Dr. Charlie, I mean, we're humans. We've had relationships in our lives, whether it's with friends, business partners, colleagues, wife, spouse, whatever. In dealing with that, have you ever been in an argument
Oh, of course.
or a disagreement? So in that time, what happens? You're in this, so this is creating emotional stress, and guess what? Your heart rate goes up, your blood pressure goes up. All these things are the same. Just like when you get on a treadmill, your heart rate goes up, your blood pressure goes up, you start sweating. That's just that is a physical stress. And then you have the emotional stress dealing with an argument or fear. If you've ever been fearful, your heart starts beating faster, your muscles tense up, blood pressure goes up. All these things are the stress response in the body. It's called our fight or flight response. And so if we think about, there's two sides of our immune system, or two sides of our nervous system, the sympathetic and parasympathetic. The parasympathetic runs your digestion. When we talk about digestion, you remember the mnemonic we kind of learn is rest and digest, or the little saying there
Yeah.
with regard to the parasympathetic nervous system. And the sympathetic is their fight or flight. So digestion, when you want to digest your food, you have to be in a relaxed state. So in order for the gastrointestinal system to move things through, you have to be in a relaxed state, because imagine if you're getting chased by a bear in the woods, you're not going to stop to go to the bathroom, are you? No, your body's in a survival mode, so it's in a fight or flight, so it shunts everything from the gastrointestinal system to the extremities, so your muscles can work faster and get more blood pumping to them. So that is a fight or flight response. But what's interesting is that this stress response, over time, our body's not meant to handle high levels of stress consistently all the time from the fight or flight response. Our fight or flight response was designed for survival. But high stress creates a cascade of events that inhibits the TSH and increases the conversion of T4 into reverse T3. This is a mechanism that the body does to preserve itself when it's under chronic stress. There's a difference between acute stress and chronic stress. So the stress hormone stays in our body for at least 90 minutes is the half-life, I believe. If you get stressed within 90 minutes and then you get stressed again, now you've got half of it gone at that 90-minute stressor point, but now you have another full load of stress hormone in your system, so now you have 1.5 times that amount. And then that reduces, and now you've got, 25% of the one before, 50% of this one, so you've got that 75% of that stress still circulating around, and then you get stressed again. And so you can see in a day's time, if people get stressed multiple times, the stress hormone circulates in their body, and it becomes chronic, and the body has to preserve energy. So our body is very energy dependent. So this stress hormone cortisol is very influential in the production of thyroid hormone and conversion because it wants to save energy. So this is typically why those with chronic stress will continue to have thyroid problems even when they're put on medications. Because the main medication people will go on is Synthroid, which is T4. But if you remember, Dr. Charlie, T4 has to get converted, correct?
Right.
Gets converted into T3. And what's the main organ that converts it?
The liver.
Ba-bam. You got it. And also the kidneys, and also the gastrointestinal tract. They're all important. And again, the kidneys is one of your main detoxifying organs as well as the liver. But the liver is what spits things out for your kidneys to clear, basically.
Right.
So the most common cause of fatigue is suboptimal thyroid function and adrenal issues because, again, the adrenals will suppress the thyroid function. Both present with low body temperature, although some signs and symptoms are shared, and many are not. Tests to rule out the adrenal glands and understand their role. So what it looks like, as I mentioned earlier, talking about the hypothalamus and everything, so the hypothalamus, when the body needs thyroid hormone, the hypothalamus will release TRH, which will go to the pituitary. However, chronic stress affects the receptor binding of the TSH on the TSH receptors in the thyroid. So it doesn't yell at the thyroid. It's kind of like putting earmuffs on. You can't hear it as well, so the thyroid doesn't spit out as much. But also what it does spit out is inactive, and then you have to convert it into liver, kidneys, and gut. And what will happen, your body will block the 5' deiodinase that stimulates the production of T3, so now you don't get the active form of T3. What you do get is reverse T3. So reverse T3, it's kind of like the mirror image, if you will. It's an isomer. It's got all the same chemical makeup, but it doesn't work at the receptor. So reverse T3 is protective and adaptive response during periods of significant stress. A slow metabolism is energy efficient, which is what the body wants. So reverse T3 lets a person live longer without food and without water. So the body is sensing that stress because, again, chemical stress could be not eating enough. Because think of when you, Dr. Charlie, when you are hypoglycemic, your blood sugar drops down. And then your body releases cortisol to bring that blood sugar back up. And the main organ that produces gluconeogenesis, which is the conversion of fats and proteins into sugar, is what, Dr. Charlie?
Tell me.
The liver. It's the liver, right? The main organ that helps to raise the blood sugar when you're in times of fasting is the liver, which again goes to the point that you have to have a healthy, functioning liver. And then if you go back, the low thyroid hormone effect, even with normal thyroid levels. So reverse T3 is huge because your TSH and everything else can look normal, but you can have reverse T3, which means that, again, you are not binding active T3 at the cell receptors. What's being made is reverse T3, which does not activate the cells to make energy. So reverse T3 needs to be recognized because, again, you can have normal TSH levels but have high levels of reverse T3, and that tells us that stress is causing the hypothyroidism. But you still have to identify what's causing the stress. Is it physical, chemical, or emotional? So that, in a nutshell, is how stress affects the thyroid.
Yeah, that's incredible. Just one thing I was going to say. It slipped my mind. Anyway, I understand that women are more prone to get autoimmune diseases than men. And can you tell me and the listeners why this happens and when women are most prone to autoimmune disease? Because you hardly ever hear about men getting lupus. You always hear about women getting lupus and other autoimmune. You always hear women about women getting having thyroid issues, although we do know that men do have them. But it's more common to hear about women having these issues. Why is that, Doc?
Well, it's because of estrogen. And the reality is there is a push-pull relationship with estrogens and estrogen mimics. And what I mean by estrogen mimics is that like environmental toxins, bisphenol A, which is in plastics, or when you're dealing with xenoestrogens or environmentally induced estrogen mimics, such as certain pesticides that can get into our water table, and dealing again with polyurethanes and all these different anes and chemicals that get into our water supply, that get into our system, those also can affect, in addition to our thyroid that we make. But if you look at this chart is amazing to me. If you can see the incidence per 100,000 people, if you look, up to 20% of the population, it's more common in women. The pink, or this pink reddish color, is the incidence of Graves' disease, which is autoimmune thyroid on the high side in women. The blue is males. If you look at rheumatoid arthritis, it's more prominent in women than it is in males. If you look at Hashimoto's thyroiditis, more prevalent in women than it is in males. Vitiligo, type 1 diabetes, pernicious anemia, MS, all these. Why? Why is this?
That is incredible. That is an incredible chart, Doc. I just got to say, because, man, that just really puts it into perspective. So basically, let me just sum this up for everybody. The fact that women have much more estrogen and they're being added in because of all the other estrogens, the xenoestrogens that are being thrown into our environment that they're now ingesting, their body has to break down. You're saying that that is the reason why women, because they have so much more estrogen than men now, more than what's normal for them. This is why they're having all these diseases pop up. Is that what you're saying?
That's part of it. Absolutely, you become estrogen dominant, and this estrogen dominance wreaks havoc on the immune system. But in addition to outside estrogens and getting them from the environment, is your own body's estrogens have to be metabolized. So hormones, my saying is hormones, whether you make them or take them, you have to eliminate them, right?
Right.
You have to eliminate these estrogens. Well, guess what they get eliminated by?
Yeah.
The liver.
Liver.
And if you don't have proper liver detoxification pathways, you can make more bad estrogens, which are called 4-hydroxyestrogens, which are cancer-causing. And then you got 16-hydroxyestrogens, which are kind of like caution estrogens. And then you got 2-hydroxyestrogens, which are the good estrogens that you want. So estrogen, whether you make it or take it, you have to eliminate it, and you want your liver to eliminate these estrogens properly. So here's what happens when you have symptoms of estrogen excess. You get cervical dysplasia, depression, anxiety and agitation, increased risk of uterine cancer, weight gain, water retention. Why? Because estrogens are toxic, and the solution to pollution is dilution.
Water.
So you're going to retain water to dilute out those toxins. Headaches, poor sleep, panic attacks, swollen breasts. Here's an interesting side note. I'm just going to throw this in there. I wasn't planning on talking about this, but cervical dysplasia, what's interesting is that estrogens will cause that. Well, birth control pills is ethinyl estradiol. Ethinyl estradiol is on the FDA's list of known carcinogens, which means a cancer-causing agent. Ethinyl estradiol also is known to deplete the body of B2, B3, B6, B12, folic acid, vitamin C, tyrosine, zinc, and magnesium.
Oh my goodness.
Yeah, and I said tyrosine. Interesting. Tyrosine is one of the main nutrients that you need to make thyroid hormone. That's the T of T4. The 4 is 4 iodines. T3 is the tyrosine again, and then the 3 is the 3 iodine. So you need that tyrosine to bind with the iodine through thyroid peroxidase in order to make it properly. So that's a side note. But going back to folic acid deficiency has been known to cause cervical dysplasia. So it's interesting if you look at the studies that folic acid, or if you look at birth control pills, that birth control pills is known to cause cervical dysplasia. Could it be that folic acid supplementation or that folic acid deficiency could cause this dysplasia because folic acid helps the cells replicate properly? Without it, dysplasia means it's precancerous. So folic acid is very key when it comes to cell replication, especially cells that divide fast, specifically the spinal cord in babies that are in utero, which is why you get spina bifida.
Right.
But also with regards to cancer, folic acid. And then if you look at products like Yaz, which is a birth control pill, guess what now? they have folic acid added into that product. Interesting.
Hmm.
Interesting research. But, you know, they'll never tell you why. But nonetheless, everybody just thinks it's good. But if you look here, if you look at estrogen excess, you get heavy periods, increased risk of breast cancer, increased risk of autoimmune disease, hypothyroidism, fatigue, irritability and mood swings, uterine fibroid, and bloating. So what's interesting here is in Thyroid 2003, estrogen fluctuations appear to be triggers for autoimmune responses. In 2006, these fluctuations can occur during pregnancy and during perimenopause. So what's interesting, if you look at that chart that I showed right here, the incidence of these significantly is increased in 2 stages. One, right after pregnancy, after they've had a baby. So almost all autoimmune cases of women that come in, I'll ask them and say, you know, when did this start? Oh, it's all started right after my 2nd child, or after my 3rd child, or it was all right after a pregnancy. And then the other phase, again, is perimenopause, right when they're reaching the menopausal state. And again, because you get bursts of estrogens at those times. During, right after pregnancy, you get these estrogen surge, and the immune system shifts. It goes from Th2, which is a protective mode, to Th1, which starts to become more of an attack mode. So the key point that I want to make with regards to perimenopause is that oftentimes women, so listen to this, Dr. Charlie, women will get these hot flashes, right?
Right.
They get these hot flashes. These hot flashes don't necessarily mean that their estrogen is all out of whack and they need to go on hormone replacement, because it could be a surge of estrogen that is causing a thyroid attack because it's creating autoimmune thyroid disease, and it's the breaking up of the thyroid cells that's releasing the thyroid hormone. And what did I say the thyroid hormone does to your basal metabolic rate? It increases it, right?
Right.
So here's a key point, ladies and gentlemen. During perimenopause, when the thyroid cells are destroyed due to autoimmune disease, it releases the thyroid hormone into the bloodstream, which increases the metabolic rate, which can cause hot flashes, insomnia, irritability, and nervousness. So it's not necessarily that, oh, you're just going into menopause. Your hair's starting to fall out, your nails are getting brittle, the lateral third of your eyebrow is going out, and you're starting to gain weight. Could it be? Just possibly autoimmune thyroid disease. So what happens is what this looks like. You become Th1 dominant. And what you want to do is it's a teeter-totter in our immune system. You want to be balanced. When you're pregnant, your body goes more Th2 dominant because your body doesn't want to recognize the embryo as something foreign. So it doesn't want to attack it. But when you're not after pregnancy, it'll shift again if you have too much of an estrogen dominance, and that will create issues. So hormone dysregulation, inflammation, infection, oxidative stress, which means you got to have proper antioxidants, and nutritional deficiencies will create more of a Th1 dominance. You need to balance it. Probiotics helps bring this back into balance. Omega-3 fatty acids, selenium, zinc, vitamin D, certain mushrooms that deal with the immune system, curcumin, reduced isoalpha acids, rosemary. These are just some of the different nutrients that help bring balance back to the immune cells. But again, ultimately, you need to have proper detoxification of estrogens. Probiotics helps with that because it makes sure you have a proper balance, that you don't detoxify estrogens in a bad way and cause reabsorption of it by Bacteroides and beta-glucuronidase.
Yeah, we also told you that we have our own omega-3, correct? Did I tell you that, Doc?
I didn't know that.
Yeah, and we made sure that it's not one of those omega-3 you buy off the shelves that say that it's got a bunch of omega-3 in it, but really it's only got a very small percent of EPA DHA. So ours has got a significant amount of EPA DHA, almost like it's like you could call it quadruple strength. So, and it's got vitamin E in it. I just wanted to mention that because, I mean, we're trying as hard as we can. We're trying to be able to come out with supplements that are going to address, you know, as much things for the entire body. And
The great thing that you're doing is you're taking products that are sound, and you're taking the time to make wonderful products that are based off of physiology and what the body needs to function properly, instead of giving some magic pill, some magic fruit of the month club that is going to go by the wayside. You're giving things based off of sound physiology, off of sound research that helps the body function and enable it to do what it needs to do naturally, as opposed to forcing it to do something with some magical potions that can be just as damaging as drugs.
Yeah, and that's exactly it. I'm trying to find our customers answers that they're not getting from anywhere else. And this is the exact same reason why I brought you on the line because after, the first time we met, man, I was like, man, this guy really knows his stuff. And so I'm very glad that we've been able to get you on the line. I know you're really busy, uh, running your businesses and studying for the medical boards and on top of running a clinic. So we're very grateful that you're able to jump on the line with us. Um, but yeah, man, this has just been fantastic. I hope everybody online right now has just been taking a ton of notes because there's so much good information in here that you can take and you can just instantly apply that would make your health so much better.
Yeah,
Um,
and what's interesting is, if you don't mind, I'd like to tell the listeners there's a simple test that can tell people if they're estrogen dominant and if it seems to be causing an issue with their thyroid. Is that something you think would be interesting for them to know?
oh, absolutely.
So, with regards to that, there's a simple test that's called T3 uptake. This test, it's performed by mixing the blood with radioactive thyroid hormone. These radioactive hormones then combine with sites in the thyroid hormone binding. The blood is then exposed to a substance called a resin, and so it deals with all this binding and unbinding and all that. But what's interesting is that basically it measures the active sites of available free T3 to bind to thyroid binding proteins. These includes transthyretin, albumin, and thyroid hormone binding globulin. So any situation that decreases the thyroid binding globulin will increase the T3 uptake. So basically, the opposite is true. Anything that increases thyroid hormone binding globulin, which means it's going to bind more of the free T3,
Hmm.
will create a low T3 uptake. So this test by itself is not helpful. You must have part of a complete thyroid panel. So I don't want people to just go out and, well, I'm just going to get my T3 uptake taken. No, you've got to have it part of a complete panel. So low levels of T3 uptake is seen in primary and secondary hypothyroidism. Primary means the thyroid, secondary means the pituitary, selenium deficiencies, and iodine deficiencies. It's normal to be low in pregnancy because, again, hormones and estrogens, what I talked about. Medications that cause it to be too low are estrogens, heroin, methadone, and anti-ovulatory drugs. Now, why estrogens? So a general rule of thumb is that in general, T3 uptake is decreased with thyroid hormone hypofunction and elevated estrogens, exogenous and endogenous. So what that means is that estrogens, what they do, the textbooks teach that, and this is where, it's not even quote-unquote functional medicine. It's just physiology, if you understand it. Estrogens increase thyroid hormone binding globulin. If you increase the binding of the thyroid hormone that's free and circulating around, you have less thyroid hormone to bind to your receptors to stimulate energy, which is why estrogen often increases weight gain.
Hmm.
Because now you're decreasing the amount. Not only are you retaining water because now you're estrogen dominant and the solution to pollution is dilution, but you're also going to increase the fat because you're decreasing the amount of free thyroid available because you've increased the binding of the thyroid binding proteins. And so now you have less to bind to the receptors to stimulate the energy of the cell and light the furnace, so to speak. Does that make sense?
Yeah, it's great.
And the opposite is true. High levels of T3 uptake is often seen in hyperthyroidism, thyroid hormone replacement therapy, protein malnutrition, because if you don't have the protein to make the binding proteins, acute stress, because again, in acute stress you need to make a lot of energy, so acute stress will allow the body to release and decrease that amount of thyroid binding globulin, so release it from that to make more available for the cell so your body has energy to flee from whatever your enemy is. Liver disease will cause issues because, again, if you don't have enough, if the liver is not functioning, you can't make the proteins, which is where most protein function and manufacturing happens, is in the liver. And kidney disease. Interesting, liver and kidneys again. So one of the things that I can tell is people that are on anabolic steroids or taking testosterone, their T3 uptake will be very elevated, which is why they have a tendency to lose and burn fat. In general, T3 uptake is increased with thyroid hyperfunction, so you're getting more free T3 because you have less of the binding proteins around, so it means you have more available T3, and a lot of the times that is done by testosterone. So here's a classic case that I want to show you that I just covered with a patient of mine. This is a 16-year-old girl She is a swimmer. She's going to college on full ride. She does phenomenal. If you look at this, actually she's 17 now, but when I first started working with her, she was 16. But if you look at her, she was born without a thyroid. So if you don't have a thyroid, you have to be on thyroid hormones. That's just bottom line, because you need it for your cells to function. So in late September of 2013, her TSH was 6.75, which was still high, but it's really good for someone that doesn't have a thyroid hormone. So if you look at her free thyroxine, it's at 1.2, which normal is 0.8 to 2.0. So thyroid is normal. So this is September 26th of 2013. So I tested her in October, just shortly after her going on, I tested her in January, just after her going on the birth control pill, because she started the birth control pill the beginning of October because her menses was not normal. She was having issues with it. What does that do? It increases ethinyl estradiol, which increases the estrogens in her body, which guess what that did? That increased the amount of thyroid hormone binding globulin, right? Which is going to decrease the T3 uptake, which means you have now less, whatever she is converting of her thyroid hormone, she is converting less of it to the active form, and she also, less of it is getting bound. Because again, the estrogens have to be detoxified by the liver. The liver is not working right. She's not going to convert. But also the estrogens are increasing the amount of thyroid hormone binding, which therefore decreases the T3 uptake, which means she has less thyroid hormone circulating around to bind to the receptors, which means the hypothalamus registers that, so it screams at the pituitary, which increases the TSH. 32 is extremely high. Cool. So then what we did is I worked with her endocrinologist. We started detoxifying the liver, getting the liver to detoxify estrogens properly. To make sure that we're getting the overload of estrogen out of the system. And then we also increased her dosage of thyroid to override that. And guess what happened? We got rid of the estrogens, so we detoxified that effectively. And now we've got high circulating around amounts of T4 and the thyroid hormone, and the TSH levels came down. Good. So this is a perfect example of someone, she's still on the birth control pills, but we helped the liver detoxify, which again took care of the estrogens and got it cleared out, which helped the T3 uptake, and so now everything's starting to function normally.
Wow, it's incredible.
So that's just a quick example of something that you can see pretty quickly. And this is a 6-week period on the before and after.
That is fast for that type of issue. That's great.
Yeah. So, with regards to, so Dr. Charlie, is there any questions that you have on that section?
No, I mean, I know obesity and type 2 diabetes is on the rise. In fact, type 2 diabetes used to be called adult onset diabetes. And I know we're about to talk about that. So can you just correlate that for us? Type 2 diabetes and thyroid dysfunction?
Yeah. So, well, it's not even, excuse me, it's not even just type 2 diabetes. It's blood sugar imbalances and autoimmunity in general, and dealing with the thyroid. So, yeah, type 2 diabetes used to be called adult onset diabetes, and that's because it was mainly in adults of 20 years, 30 years of bad lifestyle, bad eating habits. And so with that said, well, children now have these bad habits, and kids that are, 12, 9 are getting type 2 diabetes, which is a lifestyle issue. It's crazy. It blows me away. So when it comes to...
Yeah, I get so many questions from children, anywhere from 12 years old all the way up to 20, asking if they can take Liveline and what they can do to detoxify their liver and all. It's insane the amount of kids, because you know how bad the social standing is in school, and with kids who are overweight and the beating that they take just emotionally. And I just feel so bad for that. I try to help them as much as I can, but you got to be careful with that also.
Yeah, I mean, absolutely. And when you're dealing with
it, yeah.
And blood sugar metabolism, ladies and gentlemen, hard to believe, I know, but guess where most blood sugar metabolism happens? In the liver. So if the liver's not healthy again, you're going to have blood sugar imbalances as well. The liver has over 800 functions in the body. It's one of the most amazing organs. It blows me away. But what I like to call, blood sugar and autoimmunity, I like
Creative.
to call it autoimmune thyroiditis. So that's because it's, thyroid and diabetes, a lot of it goes hand in hand. Dr. Charlie, I cut you off, but did you want to say something?
No, you're good. Keep going.
Okay. So when it comes to carbohydrate metabolism, in the form of type 1 diabetes is connected with autoimmune process, as well as type 2 diabetes is connected with the increase in insulin resistance, which means the cells aren't listening to the insulin to pull it in anymore, so the cells have become deaf, occurs an average of half of the patients with Hashimoto's thyroiditis. Holy smokes. Read that again. Carbohydrate metabolism disorder in the form of type 1 diabetes connected with autoimmune process, as well as type 2 diabetes connected with an increase in insulin resistance, occurred in the average of half of the patients with Hashimoto's thyroiditis. Elevated insulin and testosterone appear to be promoting factor for development of autoimmune thyroid dysfunction. And lastly, high levels of insulin promote elevated concentrations of Th1 cytokines. So again, now we're going back to the immune system, which attributes to the promotion of autoimmune thyroid disease. Now, I can't talk in depth about this, but just go back to the Th1 dominance. And I talked about estrogen, right? Remember that?
Yep.
So when we're talking about estrogen, well, guess what? When you have increased testosterone, which we just mentioned right up here, with elevated insulin and testosterone, guess what? The more fat cells that you have in the body, you have an enzyme called aromatase. Aromatase converts testosterone into estrogen, which again makes you more estrogen dominant, which makes it more Th1 dominant, which increases the risk of having autoimmune diseases in the body. So again, this all contributes to the autoimmune thyroid disease. So here's a classic case. So here is a patient that I was working with, and this is a report that this is a report that we've created so people can graphically see where things are at. And what's interesting, and we'll talk more about this in just a few moments, but if you look, anything above 50% is out of the clinical range. But if you look, vitamin D deficiency, her vitamin D is at 14. 30 to 120 is what they consider normal, and if you actually look at that, what's optimal is considered 50 to 70. 25-hydroxyvitamin D is made in the liver. If we look at the thyroid, the TSH is through the roof, which means she has a underactive thyroid. She also has elevated hemoglobin A1C, which increases the risk of type 2 diabetes. Her glucose is 153. That's fasting. So all this tells me right now this is a diabetic patient. Her LDL, which is the bad cholesterol, quote unquote, it's not really bad. Well, we can't talk about that.
Yeah.
I'm sorry. We can talk about
Do
that
another
another
one
time.
on that one.
Yeah, and then insulin. The insulin is elevated. I don't like, they allow in America up to 24.9. Well, anything above 4 is considered not good, and really anything above 8, in my opinion, is not good at all because it's indicating early insulin resistance. But it's normal. The reference ranges are built off of the normal population, and it's normal in America to be overweight and early type 2 diabetic, so that's why the norm has become wider and wider, even though research says just the opposite.
Right.
But nonetheless, if you look at her free T4, it's on the high end, and her thyroxine is on the high end. So she has this elevated T4, but the TSH is elevated. Why? Because it tells me that we're not converting properly, and we're having issues, but it also tells me something else. This patient, when you have T4 and T3 elevated, well, that can tell me that the high T4 and T3 is possibly due to the increased testosterone, as this patient also has what's called a polycystic ovarian syndrome, which is accentuated by the insulin that converts your progesterone to testosterone, and it's a big feed-forward cycle. Everything connects. But nonetheless, guess what? I tested her antibodies. Sure enough, she's got both antibodies to her thyroid, creating autoimmune thyroid disease. And again, this is very prevalent in up to 50%. Over half is what they say, people with metabolic syndrome or insulin resistance and autoimmune thyroid disease. 50%.
Jeez.
It's crazy.
That is. Wow.
So there's a little bit of a connection there with the insulin and blood sugar. So you can't just look at the thyroid. You got to look at the body as a whole to make the connections to understand overall how the body is working.
So, yeah, I know that you've mentioned vitamin D, iodine, and selenium, but are there any other nutrients that are important to have for normal thyroid function?
Yeah, absolutely. You know, when it comes to when it comes to nutrients and other factors that equal hypothyroidism, I mean, ultimately we are in control of our environment and what happens in our environment. And so we're in control of what nutrients gets into our body. But here's a great slide that I love that comes from the Institute of Functional Medicine. It says factors that inhibit proper production of thyroid hormones. It's things we've talked about, infections, toxins, autoimmune disease, celiac disease. But factors that affect the conversion of T4 to T3 is selenium and zinc. You see that right there.
Mm-hmm.
Factors that improve cellular sensitivity to the thyroid hormone is vitamin A, exercise, that's right folks, we have to move, and zinc. So then other factors that increase the conversion of T4 to reverse T3 that I talked about is stress, trauma, low-calorie diet. Why? Because that increases stress in our body. Inflammation, because that's a sign of stress in our body. Toxins, because that creates a chemical stress in our body. Infections, because that creates stress in our body. Liver and kidney dysfunction, because that creates stress in our body. And certain medications, because that creates stress in our body. Factors that contribute to the proper production of thyroid hormone are things such as iron, iodine, tyrosine, zinc, selenium, vitamin E, B2, B3, B6, vitamin C, and vitamin D. And what did I say about ethinyl estradiol, the estrogen? It depletes the body of vitamin B2, B3, B6, B12, folic acid, tyrosine, zinc, and magnesium.
Wow.
Crazy. A lot of those are the nutrients that the body needs for the thyroid to function. So if you look at hypothyroid and vitamin D, if you have a deficiency in vitamin A deficiency causes a decrease in iodine uptake, which you need for the thyroid to make, which impairs the thyroglobulin synthesis and the coupling of making the iodine and thyroid hormone. It increases the thyroid size. Severe vitamin A deficiency, the pituitary gland with elevated TSH becomes insensitive to the feedback control of the thyroid. So you need it in order for the thyroid to control or communicate back and forth with the pituitary function. So without vitamin A, the pituitary can't function properly. Why iron? Because the thyroid peroxidase, the enzyme that's needed for making iodine in the thyroglobulin to make the thyroid hormone, is also the thyroid peroxidase in the thyroglobulin molecule is a heme protein that is required for iron for its synthesis and activity. Iron deficiency reduces the activity of the thyroid peroxidase because they're related. You've got to have that. And zinc deficiency, it can occur due to increased gut permeability, dysbiosis, which means you have an imbalance of good bacteria and bad bacteria, stress, because zinc is used for infection, stress of an infection, because the immune system uses zinc. You hear a lot of people take, oh, I take zinc lozenges when I get a sore throat. That's because it helps stimulate the immune system, and you need more zinc in order for the thyroid to function. It's kind of like your car needs gasoline if you're going to keep driving it.
Right.
Same thing. If you're going to be driving your immune system, you've got to have zinc in order for that to happen. And you need thyroid to do that because the immune system is very energy dependent, meaning you need lots of ATP. So if you get frequent illness, well, that's a sign of hypothyroidism as well, because you need ATP to run the immune system. And I mean, think about it, Dr. Charlie. I'm sure you've had the flu sometime in your life, right?
Oh, yeah, of course.
So, I mean, did you feel like going out and running a marathon or doing one of your intense workouts?
No, all I want to do is sleep.
Exactly, because your body needs to rest because you need to save the energy because your body needs it to fight off this infection. And the thyroid is very integral in that process because the thyroid is what stimulates every cell in the body to make ATP and energy. Zinc deficiency can decrease the overall conversion of T4 to T3 as we talked about. And I want to talk about iodine because there's some doctors that will talk about iodine and say that everybody and their brother need to be on iodine. Well, you can have iodine deficiency. That can cause an issue. But you can also create autoimmune thyroid by taking too much iodine. I had a patient that was taking 50 milligrams of iodine. Now, the recommended daily allowance is 150 micrograms. So that means that person was taking thousands of times more the recommended amount. And guess what? They end up getting autoimmune thyroid disease because of taking too much iodine. Iodine is a limiting nutrient in individuals for the production of thyroid hormone. Thus, adequate levels of organic iodine are important for thyroid production. Iodine is a major cofactor and stimulator of the thyroid peroxidase. And TPO is the enzyme that is under attack in Hashimoto's thyroiditis. It appears that increasing iodine intake especially as a supplement, increases the immune attack on the thyroid. This is New England Journal of Medicine, 1995. They don't really know the mechanism, but they do say selenium may protect the thyroid from large doses of excess iodine. So that's something else that can contribute. But people just need to be cautious. Don't just haphazardly go out because you read in a book of taking copious amounts of iodine. You have to know what your body is doing, or you're going to cause wreak havoc, because drugs, they either stimulate or inhibit a body function. They don't do anything truly to make the body healthy, besides maybe take the stress off of some things and by inhibiting some processes. But you've got to have the right nutrients. But at the same time, you can get too much of something and it be a bad thing. It's all about balance, ladies and gentlemen. You have to have balance in our system. So that's a little bit about the nutrients.
Wow. Yeah, no, I hope, like I said, I hope everybody's taking a lot of notes, because he's going through some really, really heavy stuff. And honestly, I think we'll be doing a recording of this webinar that we'd be able to pass around, because I know that some of you will want to listen to it again, because there's just so much good content in here that you can take away.
Well, and Dr. Charlie, if you remember, at the beginning of this little section when we were talking about the nutrients, I said we're in control of our environment, right?
Yes, we are.
And what I'd like to do is I've got a slide that I want to show that, people say, oh, well, it's genetic. My mom was overweight, so I'm going to be overweight. My dad was overweight. My dad had heart disease. I'm going to have heart disease, so on and so forth. Less than 5%, the research shows less than 5% can be attributed to genetics with regards to the number 1 and number 2 killers in America, which is heart disease and cancer.
Right.
And number 3, autoimmune disease that plagues us. So in the industrialized nation. So what I want to do is cover this slide for a second, that, ladies and gentlemen, you are in control of your body. You are in control of the environment that it goes into. You control that, right? But, I'm not wrong in saying that, right? We control who we hang around. We control what goes into our mouth. We control what goes onto our skin. We control what's in our house, right?
Absolutely, yes.
So our environment is controlled by us. Our environment that we create and oftentimes in America, is toxic chemical exposure, stress, and negative emotions. We're built for love. Negative emotions that create stress in our body is a learned behavior. Poor diet. So we're in control of that. Lack of exercise, drugs, alcohol, trauma, smoking, radiation. Sometimes you're not in control of the radiation and the chemical exposure we get just because of the air and the land in which we live in. But, you can do the best that you possibly can. Well, all these things, this environment interacts with our body. And it comes in and interacts with our body. And when it interacts with our body, it starts to make it not function right, because our body was made to run off of vitamins, minerals, proteins, fats, carbohydrates, and water. And so we get decreased energy production. Why? Because it's affecting the thyroid. Poor detoxification, the liver's not working right. Gastrointestinal problem, which means they probably need perfect biotic. If you look at hormone imbalances, we've talked at length about that, causes structural stresses. We look at emotional stresses, inflammation, immune imbalance, and oxidative stress. All these things come in, and it affects the cells. All of this comes in because our body is made up of 100 trillion cells. And if these things are going wrong, it means the cells aren't working all the way down at the level of the cell, all the way down inside the nucleus and the DNA. So this makes bad genes. It makes you feel sick, which ultimately leads to, guess what? The chronic lifestyle diseases that plague Americans today. And on top of that list is autoimmune thyroid. We are in control of our environment to make our environment good or bad. Ladies and gentlemen, you have that control. You have to decide what you want to do. Because traditionally in America, it's like this. It's what I call the fireman versus the hose. The fireman versus the handyman. If your house catches fire, Dr. Charlie, who are you going to call?
I'm going to call a fireman.
Right, and the fireman's going to come in with his axes and hoses and bust your window down, bust your windows in and hose it all down, right? He's going to put the fire out in your house, right? That's what he does. That's his job, right?
Exactly.
He saved your house. That is where medicine comes in. Acute emergency medicine is where we rank. The problem is we're calling the fireman when we need handiwork, because Monday morning when your house is all waterlogged and you've got all this damage from the fire department coming in and saving your house, are you going to call the fire department Monday morning to come in and help repair it?
They're probably not going to answer.
Yeah, you know, you're not going to do that. And why? Because they have a different set of tools. They have axes and hoses. What you need, ladies and gentlemen, is you need a handyman. And you oftentimes are your own handyman. You just have to know what to do. The handyman has a tool belt with multiple tools that will allow him to help fix your house and repair your house. And oftentimes, you have those tools. You have that tool belt. You just have to know what to do, ladies and gentlemen. So when it comes to medicines, there's a time and place for medicine, ladies and gentlemen, without question, a time and place. But don't mistakenly call the fire department to come in and do the patchwork and spackling on your wall, because it's going to be done with an axe and it's not going to be very pretty. You know what I'm saying?
Yeah.
And you have to understand and find out what's the root cause of your problems. Because coming in and putting out the fire with the fire hose may not fix the problem. Because let's say there's an electrical circuit problem and you never fix that. You rebuild the house gets rebuilt, you fix all the problems, but you fix all the damage that was done, but you still have this as an electrical circuit problem. Guess what? The house is going to catch fire again, won't it?
Yep.
Because you never went back and fixed the underlying problem. And so that's what you have to do, ladies and gentlemen, but you have to find out what's broken, what's the root cause, and what's going on. And so that's where, you know, this is one of the things that I do is we use this report, that this report will allow people to look at things with regards to their physiology. So right off the bat, it allows you to look and see what's high and what's low. It's looking at your whole body. You're looking at your blood sugar. You're looking at your thyroid. You're looking at your liver and your kidneys. You're looking at your immune cells, your red blood cells, seeing how everything in your body is functioning. How does all this go together? Because what's causing your dysfunction is the most important thing. You're only as healthy as your weakest link. And so then this page looks at everything graphically, where you can see all the things that are high and low very quickly and see where your body is at. But on top of that, it'll make food recommendations based off your blood work that will tell you and say, don't eat these foods, eat these foods, based off of your own body chemistry. It'll give nutrient recommendations. On top of that, mathematically, it correlates and tells you what's the highest problem. So in this patient, it was carbohydrate metabolism, liver function, cholesterol issues, oxidative stress, and cardiovascular risk and inflammation and kidney dysfunction. So you can see those are the top problems with this specific patient. And then if you look here, it'll give you an idea of what's wrong. So when you look at triglycerides, you know, most people don't know what triglycerides are or what ferritin means. This report will tell you what's wrong with it. It'll also tell you what medications can cause a problem. So you may be able to look and say, hey, I'm on this medication that causes this.
Wow, that's huge.
Yeah, it's absolutely huge. So if they're taking it, it could cause that problem. They may want to discuss it with their primary care or their prescribing physician. It also will recommend possible other additional tests that you may need to take. So this, again, is not a questionnaire. This is based off of their own blood work, understanding where it's at. And so these are things that people have access to that you really need in order to understand what's broken in your body. And this will tell you, okay, it says carbohydrate metabolism or cardiovascular risk. It'll tell you why. Why is it recommending vitamin C? Well, because this was low and these were high. Or why chromium picolinate? Because these were elevated. It'll tell you exactly why, so you have that understanding. So that is a basic report. It'll also tell you things to avoid and why to avoid iron supplementation if you're because, again, in this patient, they had increased iron load. So they don't want to take foods and nutrients that have iron in it. This will also tell you all the things that are off in your blood. It'll flag them multiple times. So if you have something off that is in your blood that is not functioning right, it will flag all the different medications that can cause that problem. So that's pretty cool. But it also graphically, instead of just looking at, you know, with blood sugar, people say, oh, my blood sugar is normal, and all they do is look at their glucose. Well, if your insulin is skyrocketed at 40, it's screaming to keep your blood sugar normal. So we look at multiple things in this report with regards to, let's say, cardiovascular risk. It's not just about cholesterol. It has to do with GGT levels, iron levels, insulin levels, C-reactive protein, which is an inflammatory marker, uric acid levels. All these things are incorporated. So you get to look at, overall, multiple things we talked about: adrenal function, allergy sign, or your allergy potential. You get to look at your athletic potential, your bone and joint health, look at carbohydrate metabolism, cardiovascular risk, cellular production, electrolyte balance. You also look at your gastrointestinal function, immune response, your inflammatory processes, your kidney function, your lipid production in your body, your liver function. So
Wow.
again, this guy's type 2 diabetic. Yeah, isn't this amazing?
Whoa.
And then you get to look at your breakdown of nitrogens in the body, your oxidative stress, your proteins, your pulmonary function, your red blood cell, and last but not least, your thyroid health, and understand where it is with regards to function. Then it also will correlate for over 220 different diseases. It doesn't mean that you have this, but it indicates, based off of the blood work, that you have a high propensity towards these processes in the body. Doesn't mean you have them. You have to be further assessed to rule in and rule out, but mathematically it shows, based off your blood work, that you have a high risk for these. So that's a key. Again, it doesn't mean that you have it, but it does increase the risk. So also with this report, you know, typically in follow-up cases, it'll mathematically and graphically compare things side by side, so you can see how you're improving. And so typically, it's a 90-day program to run something like this. And so when you look at a program of this nature, it's 90 days long, because again, the red blood cells last about 120 days. Your hemoglobin A1C lasts, it'll let you know what your blood sugar regulation is over 90 days. So a comprehensive blood work like this, to run all the blood work, it retails for $2,211 worth. This is going to be run twice. That's $4,422. You add in the thyroid antibodies, the anti-TPO and anti-TG antibodies, that's $106.50. You multiply that times 2, that's $213. You got to add in the reverse T3 at $81. That's $161 because you're being run twice. And then you also get consultations, which is $300 each time, and you're having 3 consultations, a total of $900. And then you get the graphical display, which is $150 each. That's another $300. So this package in doctors' offices runs for $5,997. So with Dr. Charlie's program, you are able to look at this and measure your body. And Dr. Charlie has the program. He's been able to work out a number of deals and shave off $2,000. So you're going to get this for $3,997 if you decide that you need something like this, which gives you a savings of $1,971. It's a 33% savings that Dr. Charlie has been able to work out. So his program through Perfect Origins, to provide you with more information for educational purposes only, so you could learn more about your body, involves this. It involves this type of blood work. The key thing is that I've been recruited by Dr. Charlie to be able to provide the consultations to educate you about your body, so you can have an understanding of what's going on. And that's what I've been asked to do by Dr. Charlie for his people, because he gets so many of you emailing him and asking him, Dr. Charlie, I don't know where to go. I don't know what to do. All my other doctors just say it's fine, I'm fine, or it's in my head, or they tell me everything's normal, but I still feel lousy. This gives you an opportunity to look at your body comprehensively in a very cost-effective manner. I mean, saving almost $2,000 as opposed to doing this regularly. And, traditionally, doctors can't run this and have your insurance cover it, because the insurance companies say you have to have a diagnosis that goes with the blood work. But again, you don't know what you don't measure, and so all your symptoms can be masked and you think it's one thing, so you run it and you say, oh, you're normal. And then they'll go back and test anything else. They don't change the diagnosis and run more tests. They just say, oh, well, it was normal, and that was their best educated guess. This gives us a comprehensive review of your body. Again, it's $2,211 worth of blood work. We test over 58 different things, and you're going to do that twice, and you get this type of deal. Just the blood work alone would cost you more than what Dr. Charlie's program is going to be costing, and that you get the consult with me for me to educate you with regards to your body. And so what I want to ask you is, what's more cost effective? Treating the cause or the effect? So suppressing the symptoms, calling the fire department all the time, or you being the handyman, but being educated on what's wrong with your body and what you need to do to get it better, providing guidance. So I want to share with you briefly just a couple things that has been very effective in just some of the clients that I've worked with. So just what's been more effective is finding the cause. So here's a patient that being normal, or normal for being abnormal. She's like, what? That was what was told to her. When requesting thyroid tests, this is the email from Chris. When requesting thyroid tests or alternative treatments, my doctors told me that I was in some range of normal, even being told I was normal for being abnormal. What? Seriously? And simply advised me to eat less, move more, and be on my way. That's what she was told. Doing the in-depth health analysis and submitting blood work and requested profiles revealed to me that I have Hashimoto's thyroiditis, and on top of that, significant food allergies, gluten, headaches, allergies, temperature imbalances, and cravings are a thing of the past. My energy and outlook are up, and I've lost 80 pounds in the process. She looks phenomenal, doesn't she? And this is, again, she was told that she was normal for being abnormal. What was that, Dr. Charlie?
I said, yeah, she looks fantastic. My goodness.
Yeah, and again, she has the perfect picture of thyroid. Look at the arms rotating in.
I know.
That is a classic sign of hypothyroidism because the energy it takes to keep the teres minor and major rotated out. And if you look here, look at her hands now. They're not rotated in, they're rotated out. That's her in a normal posture now. So maybe your poor posture necessarily is not because you have poor posture and you're lazy. Maybe it's because your body doesn't have the energy to maintain your posture.
That is a fantastic statement right there.
Yeah, I mean, it's huge. Just looking, so that's something that I do is I look at the body physically too. Look at the moon face. Look at the hair receding, the puffiness under the eyes. This is myxedema. Classic thyroid case. You don't see that anymore. Her roundness has gone away. Her hairline is coming back. The lateral third of the eyebrow is coming back in. Phenomenal. So what I also want to share is the mom and daughter, what their emails said to me that I just recently got in. So here's from the mom. On Christmas morning of 2012, I realized that I was losing a substantial amount of hair every morning in the shower, 300 and more a day. I counted. My online research into what possibly could be wrong led me to thyroid issues, especially when I added to the fact that my hair had become dry, snarly, and I was even colder, whereas I was usually overly warm person. When I got to my general practitioner, I was basically told I was getting older and these things happen. I had to practically beg him to test my thyroid. When he finally did, and my TSH, T3, and T4 came back normal. When I continued to ask questions, he referred me to a dermatologist who also stated that my hair loss was due to aging and suggested I use Rogaine. The menopause specialist I met with also said that my hair loss and eyebrow thinning was resulting of aging. When I brought up the fact that my daughter was also losing a large amount of hair, their response was, that is coincidental, and she could be losing hair because of puberty. My daughter's pediatrician also said her hair loss is probably because of puberty, but did order a heavy metal detox screen, which came back normal. So that was great that they at least tested that. I tested our home water and air quality, normal. I was frustrated and desperately, and it was very frustrating and depressing. Knowing something was wrong, I was able to find the answer. I was unable to find the answer. And that was until I found Dr. Bentley. He actually listened and heard everything that I had to say, asked me questions, and his first response was he thought that I was a thyroid and I needed my thyroid tested, including the antibodies. My first lab test with Dr. B showed that I not only had high thyroid antibodies, but extremely low vitamin D and high insulin. Which also led to the Cyrex testing that showed that I had celiac disease and reacted positive to multiple cross-reacting foods. This came as a total surprise as I did not have any stomach issues and other reactions that would lead me to think that I had a gluten or food allergy. The past 10 months, I have been gluten and cross-reactive food-free, basically eating a paleo-type diet, taking supplements recommended by Dr. B, and made the lifestyle changes of limiting sugar, drinking lots of water, and trying to add in daily exercise. The following are improvements of ailments. Some I have attributed to getting older. I have experienced no more aches and pains. I don't have the granny walk around in the morning until my body gets going. I can literally jump out of bed and start running. Way more energy and stamina, more flexibility, clearer thinking, less brain excuse me, less brain fog, better quality of sleep, sleeping through the night, happier, more joyful, and didn't realize how depressed I was until it was gone. Better waste elimination, i.e. liver and gastrointestinal function, and in frequency and form. I've lost 50 pounds in the last 5 months, and I'm still waiting for the hair to stop falling out and grow back, but considering I thought that I would be bald a year ago, I'm trying to be patient. I'm feeling very blessed to have found Dr. B and his report, having the action plan, and be on the road to recovery without my thyroid and other health problems that were making me ill without even knowing it. So that is the mother's response. Pretty phenomenal response. Now, the hair falling out has slowed back significantly, but it's still happening, and that's because she still has antibodies circulating around, and it takes up to a year for the antibodies to stop circulating around once you remove the offending substance. So it will take a while for that to happen, but we're in that process.
Wow, you had to feel just incredible after getting that testimony. That is really something. Such
Yeah,
a sort of hope. Like it is. Wow, I'm
yeah,
thrilled.
and that's it. You know, it's literally hope. And so here's interesting. So what the daughter said is that a year ago I thought I was pretty healthy. My whole life, with the exception of yearly checkups, I had only went to the doctor 4 or 5 times for any illness. The only complaint, health-wise, I had was that I was fat. Even though I was involved in sports year-round, I ate pretty healthy. Last year, my mom noticed that I was losing hair at a faster than normal rate, as she said. My mom was tested by Dr. B, and then I was as well. Dr. B's testing showed that I had gluten intolerance, celiac disease, and was also allergic to eggs. I thought this was pretty weird, that I had been eating both my whole life and my stomach had never hurt and I did not get sick. This seemed to be what was triggering for me to have autoimmune thyroid disease, causing my hair to fall out. Since going gluten and egg free for the last 10 months, I've lost approximately 25 pounds. I'm down 2 pant sizes, and I have much more energy and stamina. Also, my antibodies to my thyroid have improved dramatically, almost negative, where they're not showing up anymore. When it comes to playing sports, my dad says I am much more athletic, limber, and mobile on the court and the field.
Oh wow.
So that's from a 13-year-old.
That
So it's phenomenal to be able to work with people like this, and so I look forward to the opportunity to helping your people discover the answers to the questions that they're emailing you on a daily basis. So with that said, Dr. Charlie, I just want to say thank you very much for having me on, that there is hope, and I think this program that you've put together is phenomenal. I appreciate the opportunity for me to be able to consult with your followers and your people to help educate them so they can learn more about themselves, whether they purchase a program or just listening to this audio that may change their life, or someone that they love change their life for the better, as it did in these 3 patients that we just described. So again, Dr. Charlie, I want to thank you very much for the opportunity to be on and the opportunity to serve and help change the world one patient at a time, or should I say one client at a time, just by educating people.
No, thank you so much, Dr. Bentley. It's definitely been an absolute pleasure for you to be here. And like you just said, we aren't here just to sell you a program. We are here to offer you another solution and offer you hope. And if you've been around around the bush and have not gotten the answers that you need, or if you think there's something else, I would definitely take Dr. Bentley up on this offer. We've tried to make this as affordable as possible. But granted, remember that you're paying for a service, and it's not just you're paying for his time. He's very busy, and I'm just grateful that he's carving out some time to see some of my clients, because I do get a lot of emails from you guys. So just to sum it up, you learned an incredible amount of information about the root cause of thyroid issues. Your thyroid and your liver are cornerstones to your metabolism, health, and well-being. And I'm very proud of Live Formula #1, but I also realize at the same time that I don't have all the answers. I don't know everything. And so one of my biggest strengths is to be able to reach out and find other people that have solutions that are different than mine, that I can actually pull in to offer my clients. And I realize that some people do have issues that need more help than just lip lean. Like I said, I'm not prideful in that way. I'm always seeking for more for my client, and which is exactly why we have this option to offer you. Let me ask you a few questions though. What has your life been like in the last 5 years? Do you feel healthier? Do you feel happier over the last 5 years? Do you feel more fulfilled? You should. You shouldn't have depression. You shouldn't go through your day dragging, like you don't want to do anything, lethargic. You should feel good. And you should be able to actually have the ability to eat your chocolate mousse cake or your cheesecake occasionally and not worry that it will end up right on your belly and your thighs. Now, I'm not saying to do that all the time, but if you want to have a treat, you should be able, your body should function well enough that you should be able to have that. And if you haven't changed at all within those 5 years, why not? Have you really given up hope on yourself? I know that when I was 16, a mentor of mine said something to me that really stuck with me. He said, Charlie, if you do what you've always done, you will get what you've always gotten. And if what you are doing isn't working, then you need to do something else that will. And you should never stop searching or never give up hope. And that's just something that has stuck with me since I was 16 and has actually just been a cornerstone in how my mind works today and how I approach problems. Now, I do exhaust every option until I find a solution, and I am a firm believer that there is always a solution. And if you have been suffering and you think that you have tried everything, then this is exactly why you should do this. Whatever you have tried before wasn't working, then try it from another angle. Oftentimes, these searches are where you find your breakthroughs and your answers. So, like I say, go ahead and hit the add to cart button below to sign up. Dr. Bentley said the program sells in clinics are $5,997. But after talking with him, consulting with him, and being able to pull some strings here and there, we were able to get $2,000 knocked off of that ticket. So the price for the program is only $39.97. And if that does seem like a lot of money, then look at it more as an investment, an opportunity to consult with one of the most elite doctors that I personally have ever met, who has more knowledge and greater success than 95% of the other doctors I've heard about in this area. My one piece of advice is to take a calculated risk. Now, there are no guarantees in a risk, and because we are trading time for money here, there are no refunds. This is an educational consult where you were trading money for a doctor's time, and you would not go to your medical doctor, you pay the bill, or your insurance company pays the bill, and if the treatment doesn't work, you don't ask for your money back. It's not a product. It doesn't work that way, and I don't mean to scare you, and I know that sounds scary, but to me what's even scarier is what happens if you don't take that chance on your health. And if it were me, I would, and I have many, many times, and I've also done that for my family as well. And what if you get one insight that you didn't know, and that one insight that you got from those tests and those 90 days that you spend with Dr. Bentley, what if that gives you 25% more comfort in your life? What if it improves your energy levels 25% more? What if it allows you to lose only 15 pounds that wouldn't come off, but you actually lost it and you keep it off? What if you're able to sleep at night? What if your doctor bills lower 25% from now on? Would that make it worth it to you? And like I said, I can't guarantee that it's going to work. In life, there are no guarantees like this, but I will guarantee that Dr. Bentley and I both will do our best to help you find a solution. I was born and raised with a never give up attitude, and there is always hope. And I also believe that there isn't any such thing as an incurable disease. There's just incurable people. If you want us to help you, then click the link below and we will help you. There is no reason that you should keep suffering if an answer could be right there in front of your face. And lastly, I just want you to know that you are worth it. You don't deserve to suffer any longer than you already have. There is a solution for you, a different path that could make all the difference. And we both want to just thank you for attending today and staying with us until the end. I know it's been a long seminar, and I hope that you found it worth it. Whether you choose to do this package or not, that's your choice. We've given you the option, but if anything, just take some of this information to heart and put it to use in your life. It seems to me that you'd be perfect to try out our offer today. So if you do it now. We've only got a few spots because like I said, he's in medical school. He's running businesses on top of a practice, and he's also got to study for board, so his time is limited. So we're only going to take, a few people a month. So as you can see, the list keeps growing. So click the link below to sign up, and we'll speak to you shortly. Thanks again. Take care, everybody. Good night.